Hi, this is Bhuvaneshwari, consultant dietitian and lifestyle coach at 6D Healthcare. Today we are going to see what is gestational diabetes. Gestational diabetes is a condition in which blood sugar levels become high during pregnancy. Nearly 5 to 8 million of Indian women are getting affected annually. Gestational diabetes goes away after women gives birth, but it can affect baby's health and it raises the risk of getting type 2 diabetes later in life. Hence, it is very important to take steps so that the pregnant women and their babies stay healthy. Women with gestational diabetes usually don't have symptoms. Hence, it is important to carry out routine blood checks to confirm the onset of gestational diabetes. Some pregnant women may feel thirstier than usual, hungrier and eat more than usual, urinate more than usual. These women should consult their gynecologist immediately. What is the root cause of gestational diabetes? When we eat, our pancreas releases insulin, a hormone that helps to move sugar called glucose from our blood to cells which use it for energy. But during pregnancy, the placenta of pregnant women makes hormone that causes glucose to build up in the blood. Usually, pancreas send out enough insulin to handle it. But in pregnant women, body cannot make enough insulin or stop using insulin as it should. Blood sugar levels raises and this leads to gestational diabetes. So, who is at higher risk of gestational diabetes during pregnancy? If you are overweight or obese, or if you have PCOS or irregular periods before pregnancy, then you have higher risk for gestational diabetes. Similarly, if you have a family history of diabetes or PCOD, then the risk of gestational diabetes is high. If you had gestational diabetes during previous pregnancy or history of miscarriages, also the risk is higher. How does gestational diabetes affect pregnant women and baby? Gestational diabetes that's not carefully managed can lead to high blood sugar levels. High blood sugar level can cause many problems for pregnant women and baby. First, let us understand how gestational diabetes affect the health of the baby. The baby can grow bigger and very large babies are likely to have a delivery related complications and may lead to C-section birth. Higher possibility of preterm deliveries and associated health risks like breathing difficulties for the baby. Babies have higher risk of developing obesity and type 2 diabetes as they grow. There are complications raising out of gestational diabetes which will affect pregnant women also. First risk is high blood pressure and called preeclampsia. Gestational diabetes raises the high blood pressure for pregnant women as well as preeclampsia, a serious complications of pregnancy that cause high blood pressure and other symptoms can threaten both life of mother and baby. If pregnant women have gestational diabetes, then it is more likely to get it again during the future pregnancy. They also have a higher risk of developing type 2 diabetes as they get older. So, it is very important to control blood sugar and to maintain optimum levels all through the pregnancy. With proper guidance, if you can make a diet and lifestyle changes, gestational diabetes can be managed effectively without causing any harm to mother and the baby. Even though every person is unique and may need a proper professional guidance, some key guidelines with respect to diet will be helpful to all pregnant women with the risk of gestational diabetes. Eat healthy, control the sugars, like avoid this white sugar, brown sugars, etc. Reduce consumption of high carbohydrate like white rice, rava, maida, wheat and root vegetables like potato. Completely avoid refined flours, avoid including this pastries, chocolates, ice cream. Don't eat fast foods, bakery items, carbonated drinks, etc. Try to include more of millets like brown rice, all your little millets, foxtail millets, etc. Consume more fiber-rich foods like above ground vegetables, green leafy vegetables, cauliflower, broccoli, cabbage. Include dal, lettuce and paneer. Take it in a moderate quantities in each meal. Consume whole fruits like papaya, apple, muskmelon, watermelon, berries, etc. If you take non-veg, include lean meats like chicken, fish in your diet. Have 3 meals along with 2 or 3 snacks about the same time every day. Make sure most of the carbs should be complex, high in fiber and low in GI. You shall add 20 to 35 grams of fiber daily. Pregnant women with gestational diabetes should stay active and to control the blood sugar levels. After getting concurrence from their gynecologist, pregnant women can do 30 minutes of moderate activities like walking, slow running, cycling, swimming every day. It is also important for pregnant women with gestational diabetes to prevent excessive weight gain during pregnancy. It is better if they lose some weight during pregnancy also, if you have a gestational diabetes. Similarly, getting proper sleep and managing stress are very helpful to manage blood sugar levels. At 6D Healthcare, we provide a holistic diet and lifestyle management program with daily monitoring and have helped hundreds of pregnant women to keep control on their weight and manage gestational diabetes to ensure safe pregnancy. Thank you. If you have any queries regarding like gestational diabetes or high sugar levels during a pregnancy, do contact us. We'll help you to clarify all your doubts and get your sugar levels under control.